Welcome to Health Focus with Dr. Scott, where we focus on your health. Today, we're actually not looking into the past, but we're looking to the future. The focus today is on COVID-19, lessons for the future. And we're very privileged to have with us really an esteemed guest, Dr. Bela Matyas. Bela, thank you so much for joining us.
Oh, you're welcome. Thank you very much for inviting me. Appreciate it.
You know, actually, you are the only guest that we've had on our show 3 times because we respect you so much as an authority and an expert on public health.
I appreciate that. I hope I don't let you down.
No, I'm sure you won't. And in fact, you are the Chief Public Health Officer for Solano County.
Yeah, I'm the Solano County Health Officer.
And I know that during the pandemic, no one else was on the news or in the newspapers as much as you. So this COVID-19 pandemic experience must be really seared into your consciousness.
Well, it was an experience. I'll grant you that. I mean, Solano County is in between the Sacramento and San Francisco media markets, so you know we were in the attention for both of them. That's probably part of the reason why we had as many interviews as we did.
I have to say, as a physician who followed this closely, that you were available and you really showed excellent judgment throughout the pandemic, in my opinion. So I really appreciate that, and I know the community does. And I'd like to ask you, we're into 2024 now. It's as if COVID-19 never happened for some of us, yet in other respects, it never seems to go away. So could you please tell us, Dr. Matyas, when did the pandemic actually begin and when did it end?
So the actual disease spreading began at the end of 2019, and that's why it's called COVID-19. We didn't declare pandemic until 2020, however. Right? Public health emergencies were declared early in 2020 after it was clear that the disease was already spreading outside of China in all of the continents in multiple countries. And it lasted for 3 years. The public health emergency declaration ended in February of 2023, and the World Health Organization declared the pandemic over shortly thereafter.
I remember, in fact, when you were first on our show, it was early 2020, and we had a cruise ship whose inhabitants were being housed at Travis Air Force Base. And if I'm not mistaken, perhaps one of the first cases in the United States occurred here in Fairfield, right, from that cruise ship?
Well, no, the first community-acquired case that was identified occurred in Solano County. So the folks who came over first from the State Department in Wuhan and then from 2 different cruise ships were housed at Travis, and among them, cases did occur, but they were cases where the exposure actually occurred in China before they came over, or occurred on the cruise ship before they came over. So those weren't locally acquired cases. The first locally acquired case in the U.S. was an individual from Solano County who acquired, acquired the disease in the course of their work.
Okay. And I remember at the time that the ship was here and that we were discussing this, I expressed some concern about the individuals being held at Travis possibly spreading the disease in the community, but it's informative to learn that apparently that didn't happen, so you were right about minimizing that risk. Yeah. I also sometimes wonder if that was sort of like trying to keep chlorine in one half of a pool. I mean, eventually if you have a pandemic, it's going to spread, right? Even if you make those efforts, I suppose.
You know, I think in retrospect, it's very clear that the COVID virus was spreading in the U.S. months before we were aware of it. Mm-hmm. And we were actually able to segregate the people at Travis and keep them from introducing it into the community, but it was already in the community. That's why we had that case of illness occur. You know, if you recall, we didn't start doing anything to try to prevent the spread until we had declared the emergency. We were quarantining at airports. We were looking at people with fevers. But it turns out that only about 5 to 10% of people had fevers. So even while we were quarantining, people with COVID who could spread it were coming through. And prior to implementing the airport quarantines, there had been a couple of months at least where people were bringing the disease into the country. So I think that, I believe that we had an idea of what we were doing and of what this disease was doing that was simply inaccurate.
As I look at the COVID-19 pandemic, we're going to focus on the future, but I'd like to know from your perspective how we did. How did we do in terms of mortality, in terms of illness, and particularly here in Solano County compared to other locations around the country? Can you give us a rundown on that, Dr. Matyas?
So how we did varied a lot based on where we were. across the country, there were different approaches that were taken and different kinds of results that occurred. Here in Solano County, we actually fared quite well. Our death rate was among the lowest, and the reason for that was that we deliberately took a different approach right at the outset than most of the other counties in the state, and certainly than the state did. I'm going to use a couple of terms that might be a bit confusing, but the state and most of the jurisdictions, most of the public health departments focused on containment of the virus. Containment means stop it from spreading, bottle it up, don't let it go anywhere. I decided at the outset that was already impossible. I mean, based on what we knew back in January, February, March, there was no way we were going to contain COVID. So we focused instead on mitigation, which is to reduce the harm that the virus was going to cause. So think of a metaphor, there's a hurricane outside. Containment is you want to stop the hurricane from having wind and rain. Mitigation is you want to find safe shelter. So Solano at no time violated mandates from the state. We did what we were instructed to do. But in addition, we focused on identifying the highest risk population and specifically protecting them. So we knew right from the beginning, because of what was coming out of Wuhan in terms of information, that the fragile elderly were the most likely to die. And the ones who were in congregate facilities, nursing homes, other types of long-term care facilities, they were our target for protection. So what we did uniquely differently than most other counties, there were some other counties that did it as well, but the majority of counties did not actually put a specific emphasis on preventing spread in that long-term care facility environment. And what we learned after the first year and a half of the pandemic is that our death rate was much lower than the state or than other counties, specifically because we had a much lower death rate in those facilities.
It's interesting because what you're describing reminds me a lot of what has been a very controversial outlook on this called the Great Barrington Declaration, which was a position statement by a number of physicians and academics. I found it to be quite reasonable, but some people really reacted negatively towards it. And it emphasized essentially protecting the frail elderly and minimizing the impact on people who are at lower risk of mortality. And I wonder if what you're describing is similar in a broad sense. I'm not suggesting that you endorse that specifically, but it sounds similar.
Well, I think, it is very difficult to be in a position where you can judge what anybody chose to do, right? I mean, we intentionally live in a country where people have the right to make decisions. At the same time, we have to protect each other from each other. So this was a difficult several years because we were trying to blend both of those concepts. And you had states and jurisdictions that were much more focused on mandates and restriction, and others that were much more focused on self-determination and minimizing those sorts of community mandates. I think that both ends of the extreme brought risks with them and harm with them. And I think that, the pragmatic approach that we chose to take was, at the outset, we had very few tools available to us to protect our community. So we used the tools we had. And what we knew is that the fragile elderly were at highest risk, and if we put a lot of person power into identifying cases, shutting them down from further exposure, doing isolation in a more intensive way so that the disease would die off more quickly and fewer people would be exposed, that was the best we were going to do to reduce death up until the time that we had vaccine. Once we had vaccine, everybody could benefit. And so, the mitigation is most effectively done with vaccine. But that tool wasn't available to us until 2021, and as we started rolling out vaccination, and so we weren't ignoring the risk in the otherwise healthier individuals. We were giving advice on what to do to be safe, but we were putting more energy into protecting the fragile elderly.
How about schools, Bela? How did we approach that, and what do you think the success was?
So I remember the conversations at the very beginning about closing schools, and I strongly opposed it. And I opposed it because I've been through multiple respiratory disease pandemics, and the only time it makes sense to close schools is when children and the school environment specifically amplify transmission. And it was very clear that in COVID that wasn't happening. So, the younger individuals were actually transmitting less than older folks, and the younger individuals were more immune to the harm of the disease relative to older individuals. They were going to get exposed anyway because, if you're closing schools, what are those kids doing during the day? Well, they're interacting with their friends at home. And the home was always the place where this disease spread the most. anyway. So closing schools, in my opinion, was not going to do anything to benefit with regard to transmission for COVID. Based on what we knew at the time, and certainly in retrospect, I don't believe that it helped at all, but it added a harm. The harm that it added was we now had to, first of all, we closed schools for part of a school year, and then the following year we were teaching people remotely at home. It's an inferior form of education for most kids.
Well, we went through this with our own children, and now they're off in college or beyond, and I think it was very devastating for them in terms of their psychosocial development.
Yeah.
They did very well as individuals, but I think that it was tough in terms of the overall experience for so many of their peers, and not to mention educationally. Before we move to future steps that we might take, I'd just like to ask, looking back, the overall preparedness for public health officials in the community when this thing exploded on us, do you feel generally pretty proud of the way the whole thing unfolded across different departments?
I think in Solano I'm proud. The biggest preparation that we did, the one that had the biggest payoff, was having ongoing, strong collaborative relationships with all of our partners. We were tight with healthcare, public safety, community-based organizations.
What was the overall number of fatalities in the county, roughly speaking, from the pandemic?
I think by the time all was said and done, it was about 445 who died of COVID here in Solano County. And that's who died of COVID. There were many more who died with COVID, but clearly didn't die because of their COVID.
And obviously, it's tough with cause of death. We were discussing it off air. Sometimes death certificates will indicate a contributing cause, and it's hard to sort out.
It is. I was actually reviewing all the medical records. So I had the benefit of looking at the entire medical record of each individual as opposed to just the death certificate. So we were able to identify what else was happening for that individual in the context of their illness.
How do you feel the community responded when the vaccine became available? Were the education efforts appropriate? Do you think that people came around to being supportive of it, or how was that whole experience?
Well, I think that there was actually a very strong support for the vaccine initially. So I think our education, our information around the initial vaccination was positive and it was well received. As time went on and we were talking about boosters, the interest definitely diminished, fell off quite a bit. But I think that the community recognized the value, and we had a very difficult time keeping up with the vaccine for the people that wanted to be vaccinated at the outset. Having said that, there are many people who chose not to be vaccinated, and that was fine. And there were some who were confused by it. So the educational messaging around the vaccine, I thought at the outset was pretty good, but I will say public health officials did a very poor job of communicating during the pandemic. We were mixed and chaotic and confusing and sometimes contradictory in the messages we gave, and I think that was actually a disservice.
I should note that there may be some legitimate concerns that people did have about the vaccine, for example, cardiomyopathy in young people and so forth. So I don't want to minimize that, but I think there's no doubt that shortly after the vaccine came online, things began to improve, and eventually the pandemic ended. I believe there has to be some association there.
Nature has a pattern, and it follows its pattern. And the pattern is that a new disease emerges, people are are completely naive to it, have no immunity. If a vaccine can prompt some immunity, then subsequent exposures will keep boosting your immunity. And over time, because the immunity of the population goes up and the virus keeps changing and tends to get weaker and less potent, that we come to an accommodation. And what starts as a deadly pandemic disease ultimately becomes one of the many diseases we deal with year in and year out.
Well, before we move on to future pandemics and all of that, I think I would be remiss if I didn't ask you, Dr. Matyas, about long COVID, because we think of COVID-19 in terms of did you survive or did you not, but I've seen a lot of patients who've had problems that they attribute to being ill, from being just deconditioned and fatigued to other symptoms. Loss of taste is one, for example. Could you comment on that and what we've learned about that?
Yeah, I think this idea of residual health effects following the acute stage of the disease is probably true for every kind of viral infection and even probably most bacterial infections that we have. I think our immune systems are so complex that this exposure can trigger an autoimmune reaction. And it's going to be made worse by deconditioning. And so I think that a certain percentage of us are going to have the long COVID symptoms, just as a certain percentage of us would have long influenza symptoms or long symptoms from RSV. The difference is that hundreds of millions of infections of COVID occurred in this country. So even a very small percentage is going to result in very large numbers of people with these chronic, these ongoing sets of symptoms. So long COVID is real. Long post any viral infection health effects are real. And I think that they are the interplay between the virus and our body.
So in other words, we have non-specific sequelae or outcomes from an illness, like being intubated leaves a person exhausted, weakened,
Yes.
with less muscle mass. And then what I hear you suggesting is there may be something more. There may be something going on with the virus stimulating the cells of the body, the white blood cells, creating antibodies against the virus. They could perhaps create some kind of, I don't know, molecular mimicry and innocent bystander effect on normal tissues, something like that we just haven't elucidated or understood yet. Is that a fair
I think that, I think that's
suggestion?
accurate. And I think, again, the point I also want to make is that it's not unique to COVID to have this type of long-term set of sequelae. And the symptoms are often similar. Fatigue is going to be an important element of it. Myalgia, arthralgia, these types of symptoms which are common in most autoimmune conditions. And so I think, our immune system is exceptionally complex, and I think that it can be essentially triggered into ongoing reactivity by this viral insult.
And of course, the complexity is that some viruses are so ubiquitous that almost everyone is exposed to them. For example, Epstein-Barr has been linked as a virus to possibly causing syndromes with severe chronic fatigue. But the complexity is that 80 or 90% of people are exposed to the virus.
Right.
So I guess you could have an exposure in a setting in which someone is susceptible to these side effects. And as you say, the percentage may be very low, but the absolute numbers might be enormous.
Because of the ubiquitous aspect of the exposures. Yeah.
Are you monitoring any of this at the public health facility for Solano County or tracking data? Is there any way to do that?
We're not doing it at the county level. It's it's not information that we receive, so there's really nothing we can do with it. But there are definitely multiple research studies underway to better understand it.
And naturally, that would be your bailiwick to keep track of that and follow that.
Yeah.
Let's now turn more to the future.
Mm-hmm.
What threats do you see on the horizon from a public health perspective? Are you concerned, for example, about other viruses? Are you concerned about infections coming from animal sources, so-called zoonotic infections? What keeps you awake at night, and what should we do to prepare?
I think the most likely source of the next big pandemic is going to be a zoonotic disease, something from the animal population. If we look at the past 4 or 5 decades, that's where the vast majority of new emerging diseases have come from. Chief among the ones we're worried about right now is H5N1, a particular type of influenza that is found in wild birds, that gets into poultry flocks, and it recently has been found in dairy cattle as well. So that transferring into the human population, this zoonotic transfer, is a realistic concern. And I think that going forward, we will continue to see emerging diseases that come to us from the animal world. I'm also a little bit worried about mosquito-borne diseases. With the changes in global climate and average temperature, we're seeing the return of mosquitoes to parts of the country, including our county, that haven't been here for a long time. And those are mosquitoes known to be able to carry diseases that used to be very significant scourges. And their ability to carry those diseases means that there is some risk that we can again begin to experience diseases that we haven't had for a while.
It's interesting because we were talking off air, and I'm going to be going to sub-Saharan Africa in a few weeks, and I have to take malaria prophylaxis. But in looking at the history of medicine, we had malaria in Italy during World War II and in the southern United States until, I believe, the early 20th century, right?
Yeah, we did. We drained swamps, got rid of the mosquitoes.
Our time is limited, but I'd also like you to comment on other infections and vaccinations. I'm a little disturbed, for example, by the recurrence of measles cases. I realize people feel strongly about this, but in addition to new developments and new inventions, are we using all of the tools in our arsenal to protect these long-standing infections like measles, mumps, rubella, et cetera, from taking off?
I think we're trying. We have vaccines, and we require vaccination for entry into public school, for people who work in healthcare, people who go to the military. So we certainly, I think, respect the importance of keeping these diseases under control, but we also have to respect people's rights to their own decisions. I mean, people have reasons for not wanting to be vaccinated. Life is always a balance, and I think that as long as the people who are uncomfortable with the vaccine doesn't become too significant in number, we will continue to keep most of these diseases under control by having the majority of people be vaccinated. So I do think that in the future we will continue to work to try to vaccinate against diseases that we can vaccinate against. We're going to keep trying to educate on prevention of chronic diseases so that people can choose to be healthier. The world is more complicated today. There are, with social media, there are countless channels through which to communicate with folks. And people have become very comfortable with listening to their own voices through echo chambers. And I think, that's our reality. I'm not judging, not good, not bad, just is. So it makes our job of educating a little bit more challenging. But at the same time, there are more avenues through which to try to educate.
I like the emphasis on education rather than a really heavy-handed, dogmatic approach, and I respect that. I've written a column, for example, on vaccinations for our local newspaper or that addressed it in some way, and I get some pushback sometimes from people who are really put off by any kind of mandate. On the other hand, even though I don't believe in a mandate, it is interesting that we're entering into a period in which there are very few living people who lived through the real epidemics in the past of conditions like diphtheria, measles, mumps, rubella, polio. And I wonder if we're losing that collective recollection. And of course, longevity increased in the early 20th century from 49 years to, at this time, closer to 80 years upon birth, and a big part of that was our efforts against infectious diseases through public sanitation and vaccinations. Wouldn't you agree?
I totally agree. I think vaccine and better nutrition are the reasons why we live longer. That and separating sewage from drinking water. It is harder to convince people when they have no anecdotal experience with something, and so that's going to be an ongoing challenge.
Our time is beginning to run down. I feel I could talk to you about these issues for hours, but I would like to ask you, do you have any advice for our viewers as we begin to go towards the end of the show about how we can prepare as a community for future public health challenges? I think a big part of it is to be involved and to educate oneself and to try to learn more and to express your point of view. But as a public health officer, do you have other advice for the community, knowing that something will come up in the future in the sense of a public health emergency, perhaps an epidemic?
I do think that education educating yourself is exceptionally important. I guess the advice I will offer is common sense and rational thinking are not your enemy. We are emotional creatures, and a lot of what we do is based on our emotional reactions to things, what our friends tell us, etc. But there are decisions in our lives that require critical judgment. And I think that remembering that there are times when common sense should be your go-to is probably the best advice I can give.
I also find that there are a lot of things that are not high-tech that we could do that would help. For example, hand washing. For example, cleanliness when coughing or sneezing. I don't think we want to go back to being 6 feet apart from each other, but those things help for so many infections. I know that during the pandemic, the flu incidence dropped almost nothing.
Absolutely. I think you're right. Washing hands, staying home when you're sick, making sure when you cough or sneeze that you cover your mouth and your nose. Those are basic things that have worked for us for hundreds of years.
Well, Dr. Matyas, if members of the public feel that they need additional information, where would they be able to contact the Public Health Service if they wanted to look up information online?
So the Solano County Public Health Department has a website with lots of information on it. So does the California Department of Public Health. So both the state and the county have websites with lots of information. And the CDC, of course, has a lot of information on its website as well.
And also, do you have any advice for travelers who might be going abroad? Because, for example, obviously with many infections, not just including COVID-19, but also including, for example, HIV, for example. Some of these conditions spread a long ways. HIV, I think, has been traced back to some remote areas in West Africa in the 1950s. Mm-hmm. So if people are traveling, it would seem that their risk of either developing an illness or possibly coming back with one asymptomatically is significant.
It is, and I think the advice would be check the CDC website for travel. They maintain a very robust website on the risks in different countries. So look ahead to where you're going to go and decide if there are vaccines that you should take, if there are medicines you should take with you. For example, malaria, you might want to take medications for prophylaxis. And I think that at least you'll be armed with the knowledge of what's a problem there now. And then add common sense. You're going to be in an unfamiliar environment. You're going to have to be thoughtful about what you eat. You're going to have to be thoughtful about what you drink. You're going to have to be thoughtful about how you interact with people. But common sense will protect you from unnecessary risk. Now, obviously, you're going to a new country, you want to taste the food, et cetera, but look at the food preparation methods. Street-provided food in some countries is exceptionally dangerous from the standpoint of you will get sick. I mean, you're going to get a diarrheal disease. So is that experience worth the outcome?
Right. Is it fair to summarize that in terms of public health planning for the future, that it's kind of a team effort? I don't believe the public health department could do it all on its own. Really, you need to maintain a partnership and a rapport with the public where we all work together to find our way forward.
I completely agree. It's never been the department by itself. We're just one piece of a much larger group of people that have to be involved.
Well, Dr. Matyas, I'd like to say it's been a pleasure to have you back on the show, and I really appreciate your support of the show and your efforts to educate the community during the pandemic. And I think it's so useful that we look back upon it, and we'll never achieve perfection, but maybe we'll continue to grow as a community and do better when the next challenge comes along.
I definitely hope so.
It's been a pleasure.
Thank you. Thank you very much.
Thanks so much, Bela. Here at Health Focus, we focus on your health. I think we've learned a lot today in this discussion with the Public Health Chief of Solano County, and all of us here at Health Focus wish you the best of health until we see you again. Thank you.